Hello everyone, I'm Anastasia signing in from NORAS. In our previous session, as we have started discussing the conditions that can lead to alteration in bowel elimination, and as we have also discussed in detail regarding the first condition, which is the constipation. In this session, we will be discussing regarding the second condition, which is the diarrhea. Diarrhea is a condition in which there will be a passage of a liquid or unformed stool because of the increase in the gastrointestinal motility. Here, usually the consistency of the fecus is liquid, and it is also in this condition that the content will be passing through the gastrointestinal tract quickly. So here the large intestine will not be able to absorb the water as well as the electrolyte. Because of this condition, that the content will be passing through the gastrointestinal tract quickly. So here the large intestine will not be able to reabsorb the water and electrolyte. And as this content contains more of water and mucus, then this would lead to a distension in the rectum, which would ultimately make one have the urge to defecate frequently. This increase in the mucus secretion is mainly caused due to the presence of irritation in the colon, and here the diarrhea can also be caused because of the association of certain disease condition which can ultimately affect the absorption, digestion, as well as secretion in the gastrointestinal tract. So as we have come to know that this is a condition in which a person will be having a frequent urge to defecate, as well as this is a condition in which there will be a passage of liquid and unformed stool. So here, as we have also discussed, that this is a condition in which there will be a large amount of water, the stool will be watery, as well as there may be presence of mucus as well. And as the content here in this condition will be passing quickly through the gastrointestinal tract, whereby the large intestine will not be able to reabsorb the water and the electrolyte. So ultimately, this would result to loss in the fluid and electrolyte, which would lead to an imbalance, as well as it will make one's body dehydrated. So what are the causes? Here there are various factors that can lead one to suffer from diarrhea. The first one is the foodborne diseases. Here, if hygienic practices is not followed, if unhygienic practices is being followed while preparing, storing, or even serving the food, then this could lead one to suffer from diarrhea. Not only that, but even if the food has been prepared, stored, and served in a hygienic manner, but if this food is not being covered, then it could lead to the flies sitting on it, laying eggs on it, and this would ultimately lead one to suffer from diarrhea if he or she is consuming that food. As we also know that there are also many vector-borne diseases that can be spread through the flies, the mosquitoes. So here, just by them sitting on it or just by them contaminating the food, it can also lead us to suffer from various vector-borne diseases. And here, when a person suffers from these diseases, then diarrhea is one of the common symptoms that we will be finding. The example for these type of diseases is cholera. In certain diseases such as typhoid, ulcerative colitis, amoebiasis, as well as mucosal damage can occur by the organisms or by the toxins, and this can also lead one to suffer from diarrhea. If a person is under certain medications such as antibiotics or even iron preparation, then this might also be one of the cause. The next cause is the food allergy or the food intolerance. So here, if a person is consuming any food product that he or she is allergic to or that they are intolerant to, then yeah, this will also be one of the cause. Surgeries and various diagnostic tests involving the lower gastrointestinal tract can also cause diarrhea. Overuse of cathartics and laxative can lead to diarrhea, as well as certain conditions like the malabsorption syndrome can also cause diarrhea. So these are the various causes. Now let us move on to the signs and symptoms. Here, if a person is having diarrhea, then it is very common that they will be complaining of passage of liquid stools. They will be having the urge to defecate frequently. They may experience abdominal cramps or pain, bloating, nausea, vomiting. And here you can also find out that they may be having fever, as well as there can be presence of blood or mucus in the stool. So these are the various signs and symptoms that you can see. Now let us move on to the treatment. So here, if a person is having diarrhea, what we can do is we must replace the fluid and electrolyte, because we have seen that a person will be feeling dehydrated. A person will be having the fluid and electrolyte imbalance. So the first step that we must take is we must replace the fluid and electrolyte level. We must also find out the cause so that here the main cause can be treated. We can also provide drug therapy in acute condition, whereby we can provide antibiotics if a person is suffering from cholera. We can provide antimicrobials if a person is having the diarrhea because of amoebiasis. We can also provide various anti-motility agents where it will be able to reduce the peristalsis as well as the motility of the gut. For example, Lomotil or even Imodium. So here, depending on the condition, depending on the cause, we will be able to treat the condition. As a nurse, you also have certain responsibilities that you must perform in order to provide care to the patient. The first one is we must replace the fluid and electrolyte. This is the first objective in the care of the patient with diarrhea. So here what we must first do is we must assess the level of dehydration. Here, if a person is not dehydrated, then we can give or we can provide fluid orally. If a person is having mild dehydration, then we can provide ORS, which is the oral rehydration salt, whereas if a person is severe dehydrated, then we can provide fluids through intravenous route. Not only that, but the potassium should also be replaced. We must provide a diet which is soft or bland in order to prevent bowel irritation, as well as we must provide plenty amount of fluid, and we must also give small feeds at frequent intervals. If the patient is bedridden or if the patient is not able to use the washroom by himself, then you can also provide a bedpan or a commode. And for these type of patient, you must also make sure that after each defecation, you must wash the anal region as well as completely dry it to prevent skin irritation. Not only that, but you can also expose the area for aeration if it is possible. Whereas if a patient is able to use or to go to the toilet by himself, then you must advise them to wash their hands thoroughly after each time they defecate. So here, these are the nursing care that you as a nurse must perform. And also, being a nurse, it is also your responsibility to educate the patient. So here as a nurse, you must educate them about the various ways that they can adopt in order to prevent the occurrence of this condition. Here, what you must do is you must advise the patient to always cover their food. You must tell them to wash the fruits and vegetables before they even consume it. You must also educate them about the importance of applying fly control measures at home. You must advise them to always heat the canned foods before they eat. You must advise them to avoid eating foods which are not fresh or spoiled. You must educate them about the importance of drinking boiled water. And also you must educate them about the importance of using a sanitary latrine. And also you as a nurse, if a patient is hospitalized because of this condition, then it is your responsibility to change the linen and to make sure that it is being washed well using a disinfectant, as well as it is being dried under the sunlight. And here it is also your responsibility that you must take the measures to prevent the contamination of food and water with diarrheal stool. So here as a nurse, these are the things that you must keep in mind, as well as these are the things that you must educate the patient about in order to prevent this disease condition. So now here we have come to the end of this topic, whereby in today's session we have dealt with diarrhea. I hope you have got a clear understanding of what diarrhea is, what are the causes, what are the signs and symptoms, what are the treatment that can be provided, as well as what are the nursing care and what are the things you as a nurse can educate the patient about in order to prevent this disease condition. So I'll be meeting you guys in another session where we will be discussing about the three remaining condition, which is the bowel impaction, bowel incontinence, as well as the flatulence. Until then, have a good day. Thank you.